Here is your stem.
Okay, I'm ready.
Both are ready?
Yes.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hello, I'm Dr. Hela. Is the SHO working for Mr. Main? May I confirm I'm calling the on-call consultant?
Yes, go ahead.
Okay. Mr. We have 70. We have. I'm calling you about the patient, 78-year-old patient had a mastectomy 2 days ago for breast cancer. Now she has axillary swelling. She had wound swelling and suction drain about 90 milli of blood, of fresh blood. Also experienced shortness of breath recently. The patient also have a background of COPD, have left ventricular failure, mild left ventricular failure, and also has and also her daughter insisted to go home and to discharge against medical advice, and she lives 60 miles away from the hospital.
Okay. So why are you calling me?
So I'm calling about here to ask you about she wanted to she went to discharge against the medical advice.
Okay. And has the patient made their own decision, or she has been bullied by her daughter?
Her daughter pulled her to do this.
Mm.
And trying to convince her, but I think she wanted to stay at the hospital and to discharge as soon as she become normal and to become stable enough to take this decision.
Okay. And is the patient alert and capable of making her own decision?
Yes, she has the capability and has competence to make her own decision, but I will see her to know.
Okay.
No, I see her and I convinced her. She is capable of taking the decision.
Okay. And did you talk to the daughter?
Yes, I wasted about 20 minutes to convince her,
Mm.
but unsuccessfully.
Okay. And what do you think happened for the patient to the patient?
I think there is possibility of having hemorrhage, recreational hemorrhage, active bleeding now. She may have this or maybe hematoma. Also, the axillary swelling may indicate DVT and maybe pulmonary embolism because of she has recently shortness of breath.
Okay. So you think that she has a DVT, yes? Because the axillary swelling.
Must be considered because the presence of the axillary swelling with shortness of breath that may indicate a pulmonary embolism.
Okay. And what is the causes of bleeding?
I think she is COPD with left ventricular failure, mild. She is taking anticoagulant, so may have bleeding, active bleeding now.
Okay. Okay. And what is this? What do you think the cause? The cause is?
I think it may be due to the anticoagulant. It may be due to DVT. May be due to her cancer and the operation. So maybe due to this, and the bleeding may be due to her condition of left ventricular failure, and she may take anticoagulant.
Okay. And what do you think the causes of her shortness of breathing, other
Maybe
than
pulmonary
pulmonary embolism?
embolism. maybe because of bleeding, so she lost many hemoglobin. So maybe this is a cause of shortness of breath also.
Okay. And what do you think the causes of
Or maybe myocardial infarction, maybe other differential diagnosis we must investigate to know.
Okay, okay. And what do you think the causes of his axillary swelling?
I think it's maybe DVT.
Okay, okay. And what will be your plan of action in the event of this complication?
As for hemorrhage, I will order full blood count, and I will check hemoglobin if it's declining or no. As regard the hematoma, I may require evacuation for hematoma. If am suspecting DVT and pulmonary embolism, so I may do duplex ultrasound and may do also CT angio. CT
Okay.
pulmonary angio for to exclude or to diagnose the pulmonary embolism.
And is she stable right now?
Yes.
Okay. And is it safe if she is stable to send her home?
No, not stable. Her home is 60 miles away from the hospital. So, we are not able to manage here if any complication occur. Pulmonary embolism and DVT may need investigations, a lot of investigation, and if diagnosed, this is not. This need treatment accordingly, and also if she has active bleeding, so must be managed. If it has hematoma, must be managed and open the hematoma, may require evacuation, so can't go home.
Okay. And what will you do if she is still consisting to go home?
I will inform the patient about the complication, and I will inform her daughter also about the possible complications that may occur, and I'm discharging her against the medical advice, and she lives away from hospital, and I will inform her about all this possible complication, and that she is responsible for all, taking the responsibility over what will happen, and that she has to sign a formal document stating that she is responsible for her condition, and I will give her also detailed discharge to give to her GP if any of the complication occur.
Okay. And what will you do if the drain was 410 milli?
400 milli.
ml.
Okay. I will go I will do all. I will manage as a case for bleeding, full blood count, inserting a two large bore cannula for replacement of lost blood.
I meant,
Uh,
what will you do for the drain? Will you leave it in, يعني after discharging, will you leave it in place or you will remove it?
After discharge,
Yes.
after discharge, I will lift it in place as it's still draining.
Okay. Okay.
Okay.
Okay. Thank you so much.
Thank you.
Thank you.
Bye.